Everybody who has joined us this evening, thank you for being here. And I promise I won't take but a couple minutes of your time just to introduce our conversation. My name is Sasha Kelchef-Korn, and I serve as Executive Director for the National Cannabis Education and Research nonprofit Realm of Caring, where we provide free support on cannabinoid therapy, data to legitimize medicinal use, and resources such as the resource available to you all at goldsteinwellness.com, which is a marketplace of vetted products designed and packed full of education from the very esteemed Dr. Bonni Goldstein, who will take us on our scientific journey today from her decades of experience helping patients. Included in the marketplace are products such as suppositories from Hello Again. We'll also be hearing from Lisa Williams, who is the fearless leader of Hello Again, to bring us her story of what brought her down this path to help women and find relief. But to kick us off, we have Ricki Lake and Abby Epstein. Ricki, who is actor, TV host, film producer, and Abby, who is film and theater director and producer, have created together the very impactful film Weed the People, as well as the remarkable The Business of Being Born and Breast Milk documentaries, and together published Your Best Birth, just to name a few of their collective accolades. Abby's current project is called the Midlife Collective, so make sure to look out for that as well. The women that you'll see on the screen today have gifted us with so much knowledge, and it is my honor to be alongside them. And as we go, just a quick reminder to our audience that any questions you have, please use the Q&A box, and we'll do our best to get through as many questions as possible at the end of our presentation. And we're also going to provide you with some links throughout the chat here, as well as through email when we send out the recording. But for now, please enjoy, and I will pass it off to you, Ricki and Abby. Thank you for being here and showing what advocacy looks like in action.
Thank you so much. It's so nice to be with you all. So for the record, I can't see you. My Zoom, you can hear me and see me. I can't see you guys. So any questions that come through, you're going to have to relay to me because I can't see them. But Abby and I are so happy to be a part of this talk today. We revere Bonni Goldstein. She is just a warrior and a superhuman to so many people. And our journey to making Weed the People and being in the cannabis space is such an unlikely one. Me coming from talk television back in the day when I did my show, I was the most fear-filled, judgmental, anti-drug person you would meet. Like, I was so close-minded to the idea of cannabis being a medicine that could help you, that wouldn't be something that you'd be addicted to. And I came full circle because of my last husband, my second husband, Christian Evans, who struggled with a lot of ailments, and was on this quest to find something outside of regular Western medicine, and started looking into CBD long before anyone like Sanjay Gupta was talking about it. And Abby and I had made The Business of Being Born prior, and we were kind of looking for what our next film would be, our next topic. And really, it was Abby that saw both of us kind of getting into the cannabis space, my husband and I, through this little girl that we had met, who was struggling with something called what was it called, Abby? It was called
It was NF1.
NF1, neurofibromatosis 1. It wasn't cancer, but they were treating her with chemotherapy, and it was really harming this child. And we went on this quest to find alternative treatments. For flying up on a private plane to Mendocino to meet this cannabis doctor. And, that became this film and this project that was 6.5 years in the making, where we followed 5 or 6 kids all struggling with cancer, different types, different stages, and looking at this medicine. And it was a remarkable experience. The film itself is so eye-opening to so many. I'm super proud of it. And I, became friends with Bonni and a patient. And we just, this world was opened up to both of us. And we're so grateful that we could use our platform to kind of raise awareness and get the conversation going, particularly with children. It takes the stigma away of just, people getting high. It was really a remarkable experience. And I'm so grateful that we made the film.
And I was just thinking, I think actually, Ricki, you and Bonni have a lot in common because, I think when we came out with The Business of Being Born and you decided to share your path to using midwifery and then ultimately home birth on your second birth, you were just way ahead of the curve. The public wasn't really ready. You were attacked. We were attacked. We had very unpleasant screenings at the hospital grand rounds where we were yelled at by many OBGYNs. And, of course, it's sort of come full circle. And I feel the same way, about Bonnie. I feel like when we started researching and making weed the people, medical doctors were like terrified to touch this on any level. They were just terrified to be associated with it. There was risk of losing your license. There was risk of, just being affiliated. And I feel like Bonnie, in so many ways, like, soon as I think we had coffee with her in a Starbucks or something, and I was like, this woman is the key. She is like key to our film. And we
Totally.
didn't know like she would end up treating, so many of the children actually who we were following. But I think, both of you women like are pioneers and like not afraid to be ahead of the curve. And so it's exciting for us to see like the cannabis space. And we know there's still a lot of issues and there's obstacles and, but it's come really so far. And so it's been really exciting for us. And I think Weed the People, it's still like very, very relevant and, used all over in educational settings and in foreign countries and, people trying to understand. And there's been it was even a tool like in Japan, we had some people in Japan that just did screenings like all over Japan because it was the only thing they had for their little, green association or green party. It was like the only tool they had to show people there's legitimate science. Um, so yeah, we're just excited to be here. And of course, we're both really passionate about women's health. So it's amazing to meet Lisa
Yeah.
Williams.
I mean, the breakthroughs that are happening with, because Abby's new project is all about the midlife and, perimenopause and menopause. And what Hello Again is doing is so groundbreaking and needed. It's just, I feel like we are reaching a new level of acceptance and education and desire. And, I think everyone's ears are open to hearing new, modalities that can help, particularly women.
Yeah, and I think it's true. And I've heard from a few women where they were like, "Oh my God, cannabis is like that's the only thing that got me through, the perimenopause transition." So, women are we're finding it anyway. You know, women are smart that way. But yeah, it's and we're just like I love that intersection for us, of women's health. And I think there's so much, and everything that you guys have done, Sasha, at Realm of Caring. I mean, that's so much where we started in this space, with trying to help patients like access medicine and, just to see like to be on the front lines, especially, with pediatric cancer. And like, Bonnie's really been there and been through it and went through it with us in the film too. But, just seeing those parents like I mean, there are some incredible stories in the film where it worked, but even when it, couldn't work or wasn't going to work, just the fact that those parents felt like they had something to try, that they weren't just sent home, just like waiting for their kid. It was to die. It was, you know, truly so important. So anyway, we just big respect for all of you on this call and what you're doing, and we're happy to serve and be advocates in any way we can, right? So
Absolutely, absolutely. And it's like we've come so far. When we started making We the People in like 2011 or 2012, right, Abby? I mean, we've come so far. It's just this, I mean, I feel like this conversation probably couldn't have been had back then, right? I mean, it's really a different environment altogether.
it was
And
like CB what are you talking about?
yeah,
Like, there was no, it was, yeah, it
no,
was, it was really, um, but yeah, so I guess we'll turn it over to
superwoman herself, Dr. Bonni Goldstein, one of my personal
Oh,
heroes. And
please.
we love you and are so grateful for you.
All right, thank you. Can everybody see my screen? Okay, so thank you to everybody who's here. Thank you, Ricki and Abby, and I hope we post a link to Abby's midlife collective to help promote some of that, because she's doing some really cool work there. And of course, thank you to Sasha at Realm of Caring for partnering. It was such an incredible organization, so please check them out. And then to Lisa too, who's going to come after me. She's going to talk about her experience and how she ended up in this space. But what I'd like to do first is, give you an overview. It's about 20 to 25 minutes, depending on how much I go off script. And just forgive me, I have a little cold I woke up with this morning. So if I start coughing, I'll mute and come right back. But I just want to talk about kind of what do we know in the research? What are women doing? That's important too. What are people finding successful? And one thing I just want to say too is that in addition to my medical practice, I started this company called Goldstein Wellness to help educate clinicians. There is no education in medical school about your endocannabinoid system or how to use cannabis as medicine. It is a big gap, a big void. So we've created this platform for licensed clinicians. If you have a state license in any healthcare field, you can join. We verify you, and then you can get in and get free education. And if you are a patient looking for help, we can connect you with educators, practitioners, licensed, and also if you need that. And it really just depends on what you're looking for. We have lots of options. And then we've also created, one of the biggest questions out there is, how do I know what to buy? It's like I'm overwhelmed. It's like me when I go into the vitamin store and there's like this wall of vitamins. And as a doctor, I think I got 1 hour of training. So everything else I know is from my own experience. And it's intimidating. And you shouldn't have to go through that if you're looking for help. So that's why we exist. That's why Realm of Caring exists. Hello again. And it's to help you navigate through this. Now, I'm just going to focus on today's topic and I'll stop talking about other things. So why does this matter? And it matters because women, we experience cyclical hormonal shifts across our life. We have higher rates of chronic pain. We have higher rates of autoimmune disease. Women are already reporting cannabis to be very helpful for things like pain, anxiety, mood, sleep, menopause, sex, and so on. And remember that research historically underrepresents women. So I'm going to share with you what we know so far. I'm not going to go through every detail here, but you can certainly go online and look at the history. But cannabis use in women's health is not new. Historical records show that it was being used for menstrual disorders, uterine pain, postpartum complications, depression, vomiting in pregnancy, menopause, and even during childbirth, it was used. It did not have the baggage and the stigma that it has today. Across cultures and centuries, so women have been using these cannabinoid compounds for the same issues that we're discussing today. So this isn't actually new. What's new is to accept it and to embrace it as medicine and to understand it, right? So that we understand what we're putting in our bodies. And the whole idea behind medical cannabis is the endocannabinoid system. This was only discovered in the late 1980s. And I'm going to admit that's when I was in medical school, so I didn't learn about it then. But what is this system? It's, we learn about neurologic system. You learn about pulmonary, it's your lungs, your cardiac systems, your heart. This is a system that crosses all of the other systems. It's a master balancing system in your brain and in your body, and it is responsible for things like pain, mood, sleep, immune function, reproduction. And it's made up of receptors, which are like locks to cells. It's made up of enzymes, and it's also very importantly made up of these compounds called endocannabinoids, endo for inner. So inner cannabis. We make cannabis. That's why when we take this plant, we know what our bodies know what to do with it. Of course, you have to take it correctly. So the way you should think about this system is that when your cells are sending overwhelming messages in response to some kind of trigger, like illness, an injury, an infection, some kind of immune challenge, what happens is this system kicks in when you need it and puts the brakes on. So it puts the brakes on pain, it puts the brakes on anxiety, it puts the brakes on nausea, and it helps get you back into balance. And the idea here is homeostasis. This is a term you'll hear a lot when talking about the endocannabinoid system. It is to balance, to help keep you in balance. And I joke around, when I was a kid, they had these blow up clowns, and you could punch them and they would go over and come pop back up. Those of you of a certain age might remember that. You have to think about that's what's happening with your body when you have some kind of trigger. You tip over, your endocannabinoid system kicks in and balances you back up. And understand that many difficult to treat chronic conditions very likely have an underlying endocannabinoid system dysfunction. And if it's not working and you can't catch up, by augmenting that system with these powerful cannabinoids from the plant, they gently nudge you in the direction of balance. And that's the whole idea behind medical cannabis. Now, you can see on this graphic that the endocannabinoid system is involved in the regulation of activity of our reproductive organs. If this system isn't working well, we end up with issues like some of the ones I'm going to talk about, like chronic pelvic pain, endometriosis, and so on. And you can see here a normal functioning endocannabinoid system is crucial to all of these different functionalities of our various organs. And I'm not going to go through all of this, but understand that a healthy endocannabinoid system, you're living pretty good. You have a good quality of life. You're not feeling too much pain. You're not overly anxious 24/7, and you're getting some sleep. And so if you checking the boxes, you're listening and you're checking the boxes, well, I'm not sleeping, I'm very anxious, and this, you want to consider that your endocannabinoid system is a little overwhelmed and might need some assistance. And again, why the endocannabinoid systems matter specifically for women is because we have, it helps balance our hormones. It interacts with estrogen and progesterone. As your hormones fluctuate during the menstrual cycle, or really during your whole cycle, your endocannabinoid system is also fluctuating as well. And of course, we know there are tremendous hormonal changes during pregnancy and menopause. Menstrual and pelvic health. Your endocannabinoid system actually influences cramping, uterine activity. So when your uterus is contracting and squeezing, that is in part under control of endocannabinoid system. Also, any pain messaging that you're getting, that's under the control of the endocannabinoid system. And that's why the endocannabinoid system plays a role in endometriosis and pelvic pain. And mood and stress goes without saying. It clearly helps with anxiety, emotional resilience. Across the board, any survey that is asking patients, what are the reasons why you're using medical cannabis? In the top 3 is anxiety, always, in almost in every survey that I've seen. Your mood and stress, of course, is linked to your premenstrual cycle, and also to a condition that's called PMDD. You may have heard of this, premenstrual disorder, where you're kind of it impairs your functioning. Right now, the treatment for that, and we're going to talk about in a little bit, are pharmaceuticals mostly. And there are many people using cannabis to help with that. And basically, cannabinoids and your endocannabinoid system help support stress recovery. I've already mentioned sleep. And of course, when you start to get into perimenopause and menopause, sleep becomes very challenging. And also, very important, your endocannabinoid system is intimately tied with inflammation and immune function. And remember, women do suffer with more autoimmune conditions. And certainly the endocannabinoid system provides a good target to try to treat, to help again balance. Remember, autoimmune means your immune system is overactive. We can put the brakes on it. Now, let's go through a couple of conditions. So this is what's called dysmenorrhea, the fancy term for menstrual pain or period pain. Remember, it's not just discomfort. It's actually driven by inflammatory compounds that we call prostaglandins. And those trigger your uterine muscles to contract. And that's what we lovingly refer to as cramps. And of course, these contractions, as they're squeezing, they're also squeezing your blood vessels, and it reduces blood flow to the uterus, which of course increases cramping and pain signaling. And again, your endocannabinoid system regulates all of this. There are many women who report using cannabis specifically for this reason. And people always ask me, well, which cannabinoid should I use? Should I use THC? Should I use CBD? Should I use CBG? One of the other ones. You have to remember that under the cannabis umbrella, we have a lot of different cannabinoids. Each person, even though you may have the same symptoms, Your endocannabinoid system is unique to you. Your lifestyle, your genetics, everything affects it. So I will, as a doctor, sometimes say, we'll start with high CBD, low THC, and just see what happens, and then we adjust. And I will tell you, there's a lot of adjustments when I'm helping patients. Sometimes we get it right out of the gate. But one of the things I like to say about cannabis medicine is we treat the patient, not the diagnosis. We treat you, because you are a whole person. You are not your diagnosis. So we do try, and I try anyway, to make sure that we dial it in for you. I could probably line up 10 women who have severe menstrual pain and who are using cannabis, and they'll probably tell you all these little, different ways that they use cannabis that are different from each other. And I want to share this study. This comes out of a group in Massachusetts led by Dr. Stacy Gruber. She's an incredibly, talk about a powerhouse. And by the way, thank you for all the accolades. Okay, but thank you for that. I forgot to say thank you. But Stacy Gruber she deserves a lot of accolades. She's leading a lot of women-focused research. Now, we love her work. So she did this survey-based, which she calls quasi-experimental study, using a high CBD suppository for menstrual-related pain and discomfort. They had two groups. One group of 77 women got broad-spectrum CBD suppositories. Broad-spectrum just means that it has all the compounds from the plant, but virtually no THC in it. And then the other group got treatment as usual, whatever, treatment those patients were getting. And they followed these patients over 2 menstrual cycles. Sorry, there we go. My animations were off. The CBD group had significant findings, okay? Reduced frequency and severity of symptoms, improved daily functioning, and less use of pain meds, and greater use. This is really interesting. Greater use led to greater symptomatic relief. So we call this a dose response pattern. And remember, this was not something that would be impairing or intoxicating. And the numbers are very interesting. 73% of the participants reported moderate or greater improvement after 1 month, and then 81% after 2 months. So I do want to point this out as a tip. There's studies in kids with epilepsy, studies in people with Parkinson's, that the longer you take, if it's working, hang in there, because remember, plant medicine just nudges you in the right direction. It takes time. You're asking a plant to change your chemistry. Remember, pharmaceuticals are designed to kind of hit like a sledgehammer. Often, plant medicine pushes you, nudges you in the direction. So 81% after 2 months, that is a very high number for people to be satisfied with a very simple treatment. What about PMS and PMDD? So remember, PMDD is premenstrual dysphoric disorder, and it's severe mood symptoms that impair daily functioning. We don't have a lot of research on this. We just have some surveys. So the first survey I'm going to talk about, this was very interesting. They were assessing women's belief in their cannabis treatment. And most of the women believe that it helped with symptoms like sleep issues, irritability, mood changes, and pain. I am a doctor who believes that, in the world of medicine, your antidote of how it works for you is not considered evidence. I kind of step away from that. If a patient tells me something is working, I believe them. I don't see any reason for someone to lie to me for something that they're buying out of pocket, right? I mean, you're spending money on this. I would think that it would be working for you. What's interesting is the women who had stronger belief in the relief that they were getting had more frequent use and had fewer reported problems. So it's very interesting when you think about the psychology of that. The second survey was just really focused on use of cannabinoids around premenstrual and menstrual phases. And what they found was that women reported that their cannabis use increased. Totally makes sense to me. I don't know if we needed a study to show that, but especially when the negative mood is high. And so that's very important. We use it when we need it. And that's the beauty of cannabis, is if you don't need it, then you don't have to take a pill every day. This was a 2022 analysis. This looked at 16 studies of women who struggled with gynecologic pain conditions. And I've listed across the top, they had diagnoses of chronic pelvic pain, vulvodynia or dyspareunia, which means painful sex. Cannabis use prevalence in all of these studies that looked at women with gynecologic pain. the cannabis use ranged from 13 to 27%. So, upwards of, close to a quarter of women who have been using it. And look at these results here. Most inhaled or used oral multiple times a week. Doses varied. And remember that I don't judge doses as too low or too high. It's what you need depending on your absorption, metabolism, excretion. We're all different in that way. And again, people can have the same condition, but even if they use the same cannabinoid or the same product, I guarantee you they're likely on different doses. But look at this pain relief. 61 to 96% across these studies. It's a very high number of satisfaction for pain. And then very interestingly, there was how sometimes when you're in pain, the doctor will ask you on a scale of 1 to 10, with 10 being the worst pain, what's your pain, right? We all heard this already. They call it a visual analog scale. Women on average in these 16 studies had a 2 to 5 point reduction on a 10-point scale over 3 months of treatment with cannabis. And what's striking here is, of course, is not every woman improved. It's that the majority reported meaningful pain relief, and a 2 to 5 point drop on a 10-point scale. This is not subtle. This is the difference between like struggling to get through your day and actually get through your day without being distracted all the time by your pain. And I'm going to focus a little bit on endometriosis. This is a real problem that we have. Women are going many, many, many years without diagnoses. And it's really, we're all told, oh, it's just cramping. But endometriosis is different. It affects about 1 in 10 women of reproductive age. And this is what's happening is your uterine tissue that's supposed to stay inside your uterus, it starts to spread and it grows outside the uterus, commonly on the ovaries, as you can see over here on the right. It can get onto your fallopian tube. It can get to other pelvic structures. It can stick to your rectum, to your colon. It can create so much pain and inflammation. Remember, inside your uterus, it's not creating chronic inflammation, but when it's outside, it is. And so I'm just going to say it's not bad cramps. It's a complex, inflammatory, and it's also a neurologic condition. Because what you'll see in the next slide, you end up having what's called amplified nerve pain, or what's called central sensitization. Your pain is actually dialed up when you have this. Diagnosis, as I mentioned, is often delayed for years. And from a physiologic standpoint, what's important here too is that the endometriosis involves many pathways that are regulated by the endocannabinoid system. And so endometriosis consists, and again, it's not just this tissue that's misplaced. You've got chronic inflammation, you've got immune dysregulation, you've got nerve pain, and then you have stress, which we all have. But when you have stress and you have endometriosis, it creates all of these pain flares. And I'm sure if anybody listening has endometriosis, I'm sure you're nodding. So what do cannabinoids do for us? And so there's a lot of different cannabinoids, but almost all of them reduce inflammation. Almost all of them help create homeostasis in your immune system. Almost all help with pain relief, and almost all of them help to reduce stress. So it seems illogical not to look at cannabinoids as a potential treatment for the symptoms associated with endometriosis. Now, this is an animal study that I wanted to show you. And so what they did here was they had rats, but they took rats and they had one group of rats that they didn't do anything to, one group of rats that they implanted endometrial tissue and didn't give them any treatment. And then the next group of rats, they implanted endometrial tissue and they gave them CBD. And what they found was that CBD reduced the cyst diameter, volume, and area, meaning the cyst shrunk. It displayed displayed antioxidant effects. It reduced the inflammation and it provided pain relief. And, if you need to see a visual here, you can see this no CBD lesion and this lesion that was treated by CBD, significant shrinkage. Now, again, this is animal studies. There are studies that are starting to look at endometriosis in women, human women, and hopefully we will have the next time I speak about this to everybody, I'll be able to share human studies. Now, we do have surveys and we have international surveys. Most of these were done in Australia and one of them was done in Germany. And what they found was that women with endometriosis have high rates of cannabis use. And one of the top reasons they say is because nothing else is working. The conventional treatments are insufficient. What do they perceive as improvements? Pain, sleep, nausea, anxiety, mood. Obviously, I keep repeating myself, but this is what cannabis is good at treating, especially when you're dialed in on the regimen that is meant for your system. And then interestingly, many patients, many women in these surveys reported decreasing pharmaceutical medications. 50 to 80% were able to reduce at least one conventional medication. Some reported being able to reduce or stop opioids. And of course, they asked about side effects, and they were infrequent or considered mild. So, and again, when we look at some of the other treatments available for endometriosis, we may not get as much bang for our buck as if we were using a cannabinoid-based treatment plan. What about sleep and anxiety? Again, two of the top reasons why women or why people use cannabis in all of these various surveys. Sleep, anxiety, and pain are the top three. So women experience, of course, higher rates of insomnia, anxiety disorder, stress-related sleep disruption, and also menopausal sleep disturbance. And this is where, of course, the endocannabinoid system is, again, plays a part here. When that system has been stressed out, when it's underactive, sleep recovery becomes harder. I used to work graveyard shift. I did it for 9 years. It took me over a year to reestablish a normal circadian sleep pattern. And I have to tell you that it wasn't until cannabis came into my life that I could take a little bit at nighttime and I was able to sleep through the night. It was such a gift to me. And it felt like a miracle, but really all it was that my endocannabinoid system was totally screwed up from working nights for so many years. And again, high stress and chronic poor sleep deplete your endocannabinoid system. There's an article out there from a number of years ago, if you're interested. It's called The Care and Feeding of Your Endocannabinoid System. You should read it. It tells you what's good for it and what's not so good for it. And it's a great article written by John McPartland. So endocannabinoid system, again, to repeat myself, involved in stress recovery and sleep regulation. If you get your sleep straight, sometimes everything else falls into place as that endocannabinoid system is functioning better. And again, we've talked about this. It regulates your stress response, your emotional resilience, and your sleep-wake cycles. Okay, now this is the part that everybody is very interested in, gets everybody's attention. There are actual studies looking at cannabis and sexual health in women, and the findings are very interesting. Multiple studies show very similar findings. So 70% of women in these studies reported a stronger desire and more intense orgasms. So it kind of gets you in the mood, so to speak. Many report easier orgasms and greater satisfaction. Women who have difficulty with orgasms reported improvement with cannabis if they used cannabis before they had sex. And then also what's interesting is that there's an association, we can't say causal, but they found an association in these reports that more frequent use was associated with lower rates of sexual dysfunction. Very interesting. Why would cannabis help with sex? And I think if you're out there and you have had this experience, you understand, reduces performance anxiety. It makes you more aware of your body and also the sensations that you're feeling. It shifts your focus away from intrusive thoughts. So I was laughing with my mom last night when I was going over this. I said, we're not thinking about picking up our dry cleaning, right? When you're engaged in with your significant other. And also it enhances relaxation, and also at times can also enhance that emotional connection. So this is something that, and I have heard this from women. I have a patient who comes to me. She has a slew of medical issues that are under control. When I first met her, though, those were her issues, and we worked on those. And she would come back every year and she'd say, everything's great. And then one year she actually said to me, and I will quote, you know, Bonni, I have to be honest with you. Now everything's kind of dialed in. I'm never going to go off cannabis because I don't want my symptoms to come back. She goes, but now I'm in menopause. I don't feel like it at the end of the day. I want to be left alone. I'm cranky. She goes, but it puts me in the mood. And I actually have a nice time with my husband. And then she said, and I don't have to worry about him going elsewhere for this. And I thought that was really interesting. That's how she kind of put that together for her. But she also was enjoying it rather than not enjoying having sex with her husband. So, all right, and then that leads us to menopause. There are other studies, but I pulled this one out because they had a very large group. 1,485 women were surveyed on their usage patterns and perceptions of cannabis during peri and pre-menopause and postmenopause. And you can see 35% of these women were postmenopausal and 33% pre. The median age was 49. 34% were currently using cannabis, but 66% had reported that they had tried cannabis in the past. And of the current users, 75% reported that they were using it for medical indication for menopause or perimenopausal symptoms. And you can see the breakdown there: sleep, anxiety, and also muscle and joint pain. And 74% reported symptomatic benefits. And I just want to add in, 74% is a pretty high number when you're talking about a condition that has lots and lots and lots of symptoms. This is, and we're winding down here, so this is very interesting. It's important to know that cannabis affects women and men differently. So this is biological, it's not psychological. And across multiple studies, women report stronger effects on lower THC doses, so meaning the same amount can feel a little bit more intense. And estrogen can enhance your sensitivity to THC. So they found that when women were in a high estrogen phase of their cycle, they actually experienced greater subjective intoxication. Women also had, what's very interesting is they drew blood on women who were using THC and they looked at the breakdown products. When you take THC orally, one of the breakdown products is called 11-hydroxy-THC. Women had higher levels of that, which is interesting. So that can influence the effects. This is why a lot of women, I think, find microdosing very helpful for THC specifically, is because we do have these more subjective effects and we're not really interested in being impaired when we have a busy day. We want our anxiety to be under control. We want our pain and inflammation to be minimized. And we don't want to be feeling all of those symptoms. And so microdosing, which means just lower doses scattered throughout the day, for some people that really helps them even out their response to THC. And so dosing, timing, and also the hormonal phase absolutely matter. And this is one of the reasons I created Goldstein Wellness, was because personalized guidance really is the key. Many people do find what works for them without that, but if you are struggling with difficulty finding what works for you, I've already tried X, Y, and Z under the cannabis umbrella and it's not helping, or you are on medications that you're concerned about drug interactions, there are drug interactions, or you're just brand new to this, you're inexperienced, you don't even really understand what is cannabis, what forms does it come in, how should I begin, where do I go? This is all how Realm of Caring, myself, and some other partners we have through Goldstein Wellness can help you figure that out. And we try very hard to make it either free or low cost for you so that you can experience the benefits. Even the products on Goldstein Wellness are offered at a medical discount. All right, and very exciting. I'm so excited. This was like another serendipitous thing that happened this week. I got contacted by a woman-owned like biopharmaceutical company. She is doing a cannabinoid-based study on perimenopause and postmenopause. They are currently recruiting women in the United States. They're looking for 100 women between the ages of 40 to 60. You may recognize Dr. Cutler. She's worked with Dr. Ethan Russo, who's also part of this as well. And so you can contact her directly at her email listed there. You can also go to the menopausestudyforwomen.com, or you can just take a quick check out the QR code. I love the little female in there. And this is something you may or may not qualify. There are inclusion criteria and exclusion criteria. This is a compensated study. So you actually, for each phase, you will actually get financially compensated. But this would be wonderful to have a double-blind placebo-controlled trial looking at women. And again, as I've mentioned, we are understudied and underrepresented in the research. So I'm really excited about this.
Wow.
And then our last one, you don't need to do this alone. Please contact us if you need more education, if you need personalized cannabinoid guidance. Goldstein Wellness has partnered with Realm of Caring and some other nonprofits so that we can help you find the relief that you need or help your loved one. It doesn't have to be related to women's health. We cover all conditions. So please feel free to reach out. All right, that's it. And again, that will be posted on Realm of Caring website as well as some others. It is my honor to pass the baton to Lisa Williams. So please share your whole thing, Lisa. I think it's wonderful. So please, your turn.
Thank you so much, Bonnie. First of all, Ricki, Abby, I love that y'all are using your resources to go find more information and document this for women. So thank you. Sasha, Bonnie, I love all of the education and the research that y'all are providing, and I'm honored to be part of this group. So thank you for including me. Bonnie, you mentioned that suppositories were used like on your little screen. It said in 1889. It's really interesting because people think it's a new form of delivery, and it's not. But I'm going to go back and just say my female wellness journey has been a bitch. And it started with polycystic ovarian syndrome when I was 21 years old. I had fibroids. I had a miscarriage. I had a hysterectomy. I had a myomectomy. I've had thyroid issues. I've had so many problems throughout my female wellness health journey. I wish that I knew more about cannabis as medicine. And Ricki, like you, I was so buttoned up and so opposed to it, and I wouldn't even think about it as an option. And a couple of years ago, I had an opportunity to get into the cannabis space through a marketing company that I own, and started learning and discovering more about what the cannabinoid system is, what the endocannabinoid system is, what cannabis can do for you, how to use cannabis as medicine. And I was going through menopause, had all the symptoms. I mean, you name it, frozen shoulder, moodiness, sleeplessness, couldn't focus, couldn't really, I had a high anxiety. I had joint pain. The whole, everything that you want to put in a menopausal woman, I had. And so I was looking for alternatives. I didn't want to really just race to go to hormones or medical conventional, the conventional way. I was looking for options and went to a functional medicine doctor, was loaded up with at least 15 to 20 supplements, spent thousands of dollars, and 6 months later it wasn't working. Nothing was changing, still felt the same. And was introduced to Hello Again, which is a vaginal suppository that has cannabinoids, and it has different cannabinoids and different botanicals in it. And we have 3 products. And I was introduced to it a year and a half ago. I started using the product myself. I monitor my sleep with an Aura ring, and I started to see, Ricki's showing hers, I started to see the difference. It started to improve. And then I started seeing that my joint pain, like I could not lift my shoulder. I'm not kidding. It was probably about right here is about the farthest I could lift it. I mean, my joint pain started going away. My anxiety started diminishing. I just started to feel like myself. I loved the product so much. The short story is I bought the company. um, the longer story is it worked. And I am so passionate about women's health and wellness. And this was a product that I wish I had during my journey, during my female journey. And if I could bring this product to other women and show them that there's alternatives, there's options, and if I could help them create agency and empower them with knowledge so that they know what's right for them and what choices they have. So I'm just going to show y'all really quick. It's a little vaginal suppository. It has cannabinoids in it. So we have three different products, one for period, which is more body relief, one for sleep, and then one for menopause, which is more mind anxiety. They melt inside your body with your body temperature. They have botanicals. Each of them have different botanicals specifically for the symptoms related. So like sleep has lavender and chamomile. They melt inside your body. They adhere to your vaginal wall, go to your cannabinoid receptors, and then provide relief throughout your whole body. And all without getting you any kind of psychoactive effect because it bypasses the liver. So it's just my honor to share a little bit about my story and my journey and bringing this product to more women and bringing my message and my purpose. So, Sasha, I'm going to leave it back to you, but thank you for letting me share.
Thank you, Lisa. And I think that the common theme here has been incredible because I think the message we're trying to get across every day in cannabis is that nothing substitutes for lived experience. And we need to be documenting that just as Abby and Ricki did. And I love what you said too, Abby, about witnessing the use of cannabis as medicine in a child and having that change the conversation. And that started the change of the conversation. And some of the best calls that I have fielded at Realm of Caring started with a mom calling about her kiddo. And then once hearing the potential benefits that exist, turning the conversation over to herself and actually including herself as a part of that conversation and how can I help me? So thank you, Bonni, and everybody for sharing so much wisdom. I hope that everybody watching feels very full after this conversation. And I kind of know that you do because I'm seeing the comments come in, and everyone is so thankful to hear everything. And I guess the first question that came in that I could ask for Abby and Ricki, are there any plans for a part two of Weed the People?
Sadly, no. Well, I mean, it. I wish. I mean, these movies are so hard to make. That one took 6.5 years, as I said. My partner who I was in, died in 2017. He was sort of the catalyst for that project. Abby's working on a whole nother thing with, her midlife collective, Abby, will you focus on cannabis? Maybe you can incorporate this for perimenopausal women for your project.
Yeah, if we get Lisa in there, of course.
Yeah, but no Weed the People too right now.
Yeah. Well, I would say that you did your job as starting the conversation that is still continuing on now and into 2026. People are still so thankful in all of the comments and sharing their stories and being brave enough. I mean, just as Lisa just was, being brave enough to share your story in a public setting, talking about cannabis is unbelievable. Bonni, there were some questions that were coming in of related symptoms, maybe for that women experience as they age, such as blood pressure, and then understanding some potential long-term effects of cannabis use. Could you talk about those two subjects a little bit since we have some time?
Sure. I'll start with the long-term effects. So there are multiple studies that show that people who use cannabis are not at any higher risk of really anything unless you smoke it and don't take good care of your gums. So periodontal disease, or gingivitis can occur with anybody who smokes. So to anybody who prefers to smoke their cannabis, I would recommend maybe looking at a vaporizer just to minimize the toxins that you're taking in. And remember too, most people don't smoke. Like when people smoke cigarettes, they smoke 10 to 20 a day often. Most people who are using cannabis don't have that high frequency, but just take care of your gums, floss and brush, and go to your dentist. But apart from that, we really do not see long-term issues with medical or with what I would call responsible use. When there is problematic overuse, you can have issues, but the studies show that once you have cessation, you stop using and get kind of what we call a washout for 30 days, kind of cognitive function, memory, and all of those things that you may have noted with chronic heavy use, that kind of goes away. As for blood pressure, so I'm a stickler on blood pressure. If your blood pressure is high, you have to remember we call it the silent killer for a reason. It affects your brain, your heart, your kidneys, organs you need, and you do not want to damage early in life. So I do believe that, and not believe, but it's been shown cannabinoids can help lower blood pressure, but sometimes it is not enough on its own to lower your blood pressure to a point where you are, quote, safe from the side effects of high blood pressure. In my practice, the patients who have been able to get off blood pressure medicine had other things that they were doing, lifestyle changes like the Mediterranean diet or the DASH diet. They had lost some weight, they were exercising more, and they felt cannabis helped contribute to that. If we take away your chronic pain, guess what? You can go out for a walk, a long walk. You can go to the gym and work out. You're sleeping at night. You're not constantly chasing the sleep and saying, oh, and if you're like me, I don't have too many vices, but back in the day, what was my middle of the night comfort was food. And that is just not good for long-term health to be eating leftover spaghetti in the middle of the night. So I think you can have cannabis as part of a healthy regimen to help keep your blood pressure down. But if you have true hypertension, borderline or higher, I do encourage you to seek the medications. I will share with you that of like kind of all the medicines out there, blood pressure medicine, there's so many different ones. You can get dialed in on one that would like be unlikely to give you either short or long-term side effects. So you want to definitely protect your heart and your kidneys.
Thank you for that. We also had some questions that came in as far as breast cancer and ADHD. I did answer with some links. We do have an extensive research library on our website at realmofcaring.org where we grab some of the peer-reviewed articles and then summarize them in some articles. I would also encourage individuals, if you have individualized questions, to also reach out to Realm of Caring and Goldstein Wellness, because as Bonni stated in the beginning of her talk, it is very individualized, the care, and understanding what works for your body based on nutrition, age, other ailments, conditions. But Bonni, since we do have some time, if you wanted to touch on those two briefly, breast cancer and ADHD, we can also follow up with some links. And then there was another question about if there's any research to support aromatherapy of cannabinoids. So those are big questions to answer. But if you want to kind of pick and choose.
Okay. If I forget one, chime in. Let me just start with aromatherapy. So I encourage people, if you're using flower, to sniff the flower before you use it. Your brain will remember that smell and connect it to how you react. And very early on, I started in this field in 2008, and I had this patient that came in and her whole aura was depressed. You could just feel it. I didn't have to ask her a question. I knew exactly why she was there. She was just down. That was her chemistry. And she told me that when she sniffs, if she sniffs the flower and it smells citrusy, she knew it would work for her depression. And again, this is very early on in my career, is very, not to use the word green, but no pun intended, but I was very green. I was still learning a lot, and I learned a lot from my patients. But I do think that there is something, these terpenes that are in cannabis, it's the fancy word for essential oils. That's what gives cannabis its odor. There are many: myrcene, linalool, limonene, beta caryophyllene. There's so many. We know that terpenes in nature are very powerful. If you walk into a pine forest and take that inhale, you almost feel invigorated, right? You're ready to take your hike. It makes you feel good. That's the terpene called pinene. And many people find when they use a flower that has pinene in it, or a cannabis cultivar with pinene, they have certain benefits from it, very similar to what that invigorating feeling is when you walk through a pine forest. So I'm absolutely into aromatherapy. I have friends and family who have lavender all over their house because lavender is very calming and it helps with stress. There was a study that showed that in elderly patients that were in an inpatient facility, if they put lavender next to the bed, their anxiety ratings went down over time. So absolutely, I would say stick, it's something to look at. One question on breast cancer. So we're going to be our next webinar next month. If you want to, I think I don't remember what the date is, but let me just look on my handy dandy calendar. The 12th of March, we're actually going to be focused on cancer and cannabis. So we'll be covering that then. But yes, women who have breast cancer are using cannabis. Some are using it for symptoms. Some are using it for to try to fight the cancer. There's a difference in the way you can use it. But we'll be talking about that next month. So I'm going to save that and make you come back for that. And then what was the last one? Anybody
ADHD.
remember? ADHD. All right. So yeah. So I didn't mean that. So ADHD is really interesting. And so there are a lot of people out there who say that cannabis, specifically THC dominant cannabis, helps them focus, helps them be creative, helps decrease the anxiety related to a task so they can get it done. Some people say, oh no, I can't take it during the day. I take my medication prescribed for me for ADHD, but it's a stimulant, and the stimulant wrecks my appetite and wrecks my sleep. So I use cannabis as my rescue medicine for my ADHD medicine. That's a very common way that people use it. And in terms of the research, yes, there is evidence that people who have ADHD may have an underlying endocannabinoid system dysregulation. And what we have to remember is that if we find that dysregulation, always the question is that the underlying cause? Is there something else? Do they exist in parallel? And I just want to say that because cannabis was made illegal back in the early 1940s, we're talking about almost, what are we talking about? 90 years of prohibition. We are so behind in the research. We have so much to catch up on. And I'm sorry, we're all here or on the right side of history. We need to help move research forward and also, understand when cannabis can be a medicine, when it's contraindicated. There aren't very many contraindications, but there are some, and we want to be careful with that. But like ADHD, we should have way more research than we have now. But there's no question. Yeah, I have a patient in my practice, a little boy, who has ADHD in addition to other conditions, including severe anxieties, PTSD, and so on. CBD dominant cannabis oil has been magical for him. Other patients, they stick with a 1-to-1 ratio CBD THC. Other patients take CBD, CBG, and again, talking about personalizing to how your body reacts to these cannabinoids. And one thing I will say is it's a journey. You have to rule things in and rule things out. I talk about that in my book. You have to figure out how your body reacts. I know people who have come in and said, well, I tried CBD, it didn't work. I start, what kind? How much? Was it really CBD? Like, I go deep because I want to find out what left this person with the impression that it didn't work, because that might not be true, because none of us should be expected to know everything about any treatment. We can all use compassionate help. And so please, if you have been struggling or you're new to this or inexperienced with it, just remember that, 20 years ago, good luck finding anybody to help you. But now there's so many people to be able to help you. And we're so happy to be part of that. So I guess that's it.
Look at that efficiency, right on time. There are more questions, but we are going to follow up with a blog. Bonni and I have done this before to answer some extra questions. I'll also grab some input from Lisa and Ricki and Abby to get in that blog as well. We'll be sharing out the link when it's available so that we had some questions about people if they can share this. Yes, please do. We want to get this information and correct education out there in the universe. And I want to say thank you to everybody joining from all over the world, literally Hawaii, Australia. Thank you for being here. And thank you to all the ladies here on the screen. It's just, it means so much, I think, to the community, obviously, but to myself and Realm of Caring as well, and all of the patients, and to have you all speak on behalf of moving this forward for quality of life for everybody. So thank you.
Thank you for having me. It's been such a pleasure. I love you guys.
Such a pleasure. Thank you.
Thank you to everybody. Thank you, Lisa, Ricki, Abby, for joining us, and Sasha for leading us. And we will post on our various social medias the link to register for the next webinar, which is going to be cancer. And then we have a number of others after that we'll share as well, trying to hit the most important topics that are out there that may be affecting you and your loved ones. So everybody have a great night, everybody. Thank you so much.
Thank you.
Yeah.
Thank you.